Hello, my name is Rodney Wambeam. My team and I evaluate prevention efforts and provide training and technical assistance across the state of Arkansas in partnership with the Division of Aging, Adult and Behavioral Services, and Mid-South at the University of Arkansas Little Rock. The substance abuse prevention system in Arkansas follows a science-based approach that encourages local coalitions to plan and carry out evidence-based strategies to decrease alcohol, tobacco, and other drug use and misuse in each of 13 regions covering all 75 counties. While this system provides a strong foundation and straightforward approach, successfully making change is more easily said than done. The best way to decrease problems like underage drinking or opioid overdoses is to collaborate on a comprehensive model of community-wide prevention. The goal of this short video is to provide a glimpse of how this is being done in Arkansas and how we can improve our efforts to have an even greater impact. To start, regions need to gather and update needs assessment data. This means the Arkansas Prevention Needs Assessment, APNA, a school-based survey of youth completed every year, should be implemented in as many school districts as possible. Regions also should collect other data to better understand their problems. This data could include everything from substance-related hospitalizations to alcohol-related motor vehicle crashes. And most importantly, all decisions about problems to target and strategies to implement should be driven by the needs assessment. If questions exist that the data can't answer, then the region may want to do original research, like a focus group with young adults, to answer these questions. Next, regions need to build necessary capacity and mobilize stakeholders to implement prevention efforts. Ideally, this would include a regional task force as well as youth and adult coalitions in every county. The coalitions would have diverse membership with relevant representation, and these coalitions would have a regional workforce they can depend upon. In Arkansas, we call this workforce Regional Prevention Providers, or RPPs, and Regional Lead Representatives, RLRs. These experts are certified in prevention and can bring the latest knowledge to their prevention communities. Moreover, relationships exist between all 13 regions and the state itself. In the end, these relationships build an army of prevention stakeholders across Arkansas. One of the jobs of this army is to make sure each region has a long-term strategic plan that lays out the targeted problems and the evidence-based strategies that will be used to impact these problems. The other job is to implement these plans. While the RLRs and the RPPs are talented and hardworking people, they can't do all the prevention in a region by themselves. They might be the face of prevention, but their main job is to lead from the shadows, to make sure coalition members also do the work of implementing strategies. Speaking of strategies, a comprehensive approach utilizes 4 important categories of prevention. In no particular order, these include information dissemination, or media and messaging. Media alone doesn't often change behavior, but prevention messaging is an important part of a full approach. Alternative events and presentations. These should complement the media and reach as many people as possible in a target population. Policy change. This really refers to policies and practices both big and small. For example, making community festivals alcohol-free or expanding a smoke-free ordinance to include vaping. And finally, education. This refers to programs with curriculums that go beyond one-time speakers to really impact a group over time. Programs for youth are most common, but programs also exist for college students and older adults of certain ages. If this isn't enough work, it's also important to understand the impact these efforts have on the targeted problems. Has underage drinking gone down? Has methamphetamine-related crime decreased? Do youth understand the risks of marijuana use? This is where my team and I come into the picture to help regions and coalitions understand and measure their hard work. We start with process evaluation. RPPs and RLRs enter the number of people in coalitions, the number of people who experience media, and the number of people who participate in other prevention activities into an online system called REDCap. Here, Arkansas collects everything we need to know about what was done and who participated. It allows us to fulfill federal reporting requirements and document efforts across the state. But we also need to know how these efforts change attitudes, knowledge, risk factors, and most importantly, behavior. Sometimes we measure immediate outcomes by pre- and post-surveying participants. We did this recently with a program in Region 5 called Catch My Breath. Results showed that youth participants increased their knowledge of the dangers of vaping in several areas. More often, we track outcomes like past month use of alcohol from APNA at the state and the regional level. By the way, did you know past month alcohol use among 12th graders in Arkansas has gone from 26% in 2016 to 20% in 2021? As evaluators, we don't just document these data, we provide recommendations and help communities use evaluation to make planning decisions. The process of preventing substance use and misuse in Arkansas is ongoing. New problems arise, and regions continually face challenges in moving forward. But when communities work hard on a comprehensive approach, real change is possible.